A mommy makeover can mean multiple things. Here in our practice in Dallas with Dr. Deuber, it means generally something to do with the breast. So a breast surgery, either a lift or a breast augmentation, or a lift and a breast augmentation. So it can be a variety of things depending on the patient, depending on how many children you've had, depending on where you are in your life, and kind of also just how God made you. So that's a really big factor in determining what you need after baby. A lot of times you have ptosis, which means droop to the breast, and so we need to do a bit of a lift. Sometimes that can be achieved with an implant, but a lot of times we need to do a little bit of skin repair as well. And then tummy. So also with the mommy makeover, you do an abdominoplasty, which is getting rid of the excess skin and pulling all that excess skin down, kind of like a window shade. So we pull everything down from just below your belly button. So you pull everything down all the way to here. You have an incision all the way across, hip to hip generally. So you're kind of trading it a little bit for a scar, but we have an amazing laser center here, and we provide the laser therapy for your scar post-operatively, which is fantastic for patients. So back to the tummy tuck, we take away the excess skin that's been created by the stretch of a child being in mommy's tummy, which we all as moms know happens. You just get that extra little, what the hell is this? And it's not very fun for us. So we get rid of that, and then we tighten your muscles back together. So you get something called diastasis when you have a baby. So your body is made this way on purpose, so that your muscles of your abdomen, so your abdominal muscles, your abdominal recti muscles separate. And it's just the fascia in between becomes greater to allow for that baby to fit in your belly. So we go in and we sew that back together. So you don't feel like your belly's hanging. Like, I don't know if other ladies, but like in yoga, I sit there when I'm on all fours and I'm like, oh Lord. Like your belly just kind of like hangs down and you're like, what in the world? And you feel like you're always having to constantly suck in, and you can't suck in as effectively as you could prior to having babies. So that's what we correct. So it's not something that people unfortunately can correct themselves through exercise or anything, because you can't put those muscles back together without surgically just sewing them back. So we go in and we sew those back. We pull down the excess skin and we sew all that back together. And we also, Dr. Deuber has been doing, for about the last, I think 2 years, year and a half, 2 years, been doing these abdominoplasties drainless. So all this surgery you can have done and not have any drains, which is fantastic for recovery.